One of the biggest challenges with the NHI is not the bill itself, but the conversation that's happening around the bill. There's a lot of people who are very interested and are major stakeholders in the bill, but are talking past each other. Because this is one aspect of our society, healthcare, that we actually can't use as a fighting point, but as a building point where we literally all need to come to the table. And this is what we were trying to do here.
It is a very relevant topic because, as we know, healthcare is at the crossroads with the National Health Insurance legislation being under review right now, and we've had medical schemes amendment bill that's also being reviewed, and the health market inquiry report which was recently released.
We represent different sectors and players in the healthcare space, and to get around the table and then to deliberate on common issues, I think is important to get alignment. And more importantly, it's also the access to the people around the table to then say, let's have follow-up discussions around these issues and to see how we can add more value by working together more collaboratively.
I think there's a fair amount of myopia in different sectors. I think there's the government sector has some myopia or blind spots, whereas the private sector also have some myopia and blind spots. But I do think that there are opportunities once we all start looking at trying to solve the same problem.
I found this roundtable very empowering. If you are a specialist in something or you are the primary propagator, you need to have time to listen to others, especially for a social transformation program such as NHI. There is general acceptance that we need to go the universal health coverage route, and we need to support the NHI and the NHI bill.
There's resistance because there's quite a lot that needs to be communicated. If everybody is on board, then everyone will understand, that we are all here to achieve a common goal.
You now understand the thinking perspective of the private medical aids, the public sector and the private health sector, the ICT industry and the technology aspect. And with the convergence of all the ideas, we then say this is probably where we need to zoom in so that we all move at the same pace and from the same direction.